Bismillahirrahmanirrahim. Today in this lecture I will discuss about cholera, its definitions, causative agent, transmission, pathogenesis, epidemiology, sign and symptom, diagnosis, treatment and prevention. Let's start definition of cholera. Actually, cholera is derived from Greek word choli, which means bile. What is the definition of cholera? It is an acute diarrheal disease caused by infection of intestine with gram-negative comma-shaped bacteria called Vibrio cholera. Actually, it is gastrointestinal infection and diarrheal infection that is caused by the gram-negative bacteria, that is comma-shaped bacteria, that is called Vibrio cholera. This infection is usually mild or without symptom in most healthy adults, but can be severe in immunocompromised person. The disease is characterized by profuse watery diarrhea, vomiting and leg cramps. These symptoms result from rapid loss of body fluids leading to dehydration and shock. Death can occur within hours when persons with rapid fluid loss are left untreated. Now, what is the causative agent? The causative agent is Vibrio cholera. Actually, Vibrio cholera belongs to the class Gamma Proteobacteria, order Vibrionales, family Vibrionaceae. This bacteria is gram-negative comma-shaped bacteria. They are slightly curved. They are slightly curved with single flagella, polar flagella at the one side. Now you should note the important property of this bacteria is that Vibrio cholera and Borrelia burgdorferi have more than one chromosome. Normally bacteria have a single circular chromosome, but this bacteria Vibrio cholera have more than one chromosome. Let's talk about the species. Vibrio, the different strains and species of cholera. Vibrio is actually Vibrio parahemolyticus causes diarrhea associated with eating raw or improperly cooked seafood. Vibrio vulnificus causes cellulitis and sepsis. Vibrio cholera, we are discussing this in detail. They are divided according to the nature into different groups, especially two groups, on the basis of O antigen. O antigen is cell wall antigen. The serogroup O1, which caused a pandemic in the 1880s, is known as the classical strain that caused the epidemic disease, where non-O1 organism either cause sporadic disease or non-pathogens. Sporadic disease, rare cases disease. The O1 organism have two biotypes called classic and E1 tar. E1 tar. The latter tar actually it is given to this bacteria. This is biotype is named because E1 tar is caused the epidemic in the quarantine came for pilgrims to Mecca, where it was first isolated, so its name is E1 tar. And the other three serotype are Ugeva, Eneba, and Hekugema. Now these biotypes are based on the differences in the biochemical reactions, whereas serotype are based on antigenic differences. These features are used to characterize, isolate in epidemiological investigations. Serogroup O139 organism, which caused a major epidemic in 1992, they are identified by the antisera to the O139 polysaccharide antigen O antigen. Vibrio parahemolyticus and Vibrio vulnificus, they are marine organisms. They live primarily in oceans especially in warm salt water. They are halophile. They require high level of initial concentration too. Now the question arises, who are at risk? You know that cholera bacteria are exceptionally sensitive to stomach acid. When the bacteria come, the acidity of they do not tolerate the acidity of the stomach. Person with impaired stomach secretion or who are taking antacids such as omeprazole, they are at high risk. Normal individual. Now, what is the infectious dose? Normal individual require about 100 million bacteria to cause the severe cholera. Now, the predisposing factor: poor sanitation, malnutrition, overcrowding, inadequate medical devices. Now, the important point is that the quarantine measure failed to prevent the spread of the disease because there were many asymptomatic carriers in 1992. Vibrio cholera serotype 0135 emerged, and you know that in Bangladesh and India they spread even the people were isolated, so quarantine is failed. Now, what is the transmission? The mode of transmission is fecal contamination of water and food, primarily from human. Human carriers are frequently asymptomatic and include individuals who are either in the incubation period or on convalescing. The main animal reservoir are marine shellfish such as shrimp and oyster. Ingestion of these without adequate cooking can transmit the disease. Now, pathogenesis. In pathogenesis, first stage is colonization. For colonization, large number of bacteria must be ingested. Large number of bacteria must be ingested because the organism is particularly sensitive to stomach acid. We have discussed it. For adherence, this bacteria is having an enzyme called mucinase enzyme. Adherence to the seal of the brush border of the gut, which is requirement for colonization, is related to the secretion of the bacterial enzyme mucinase, which dissolves the mucus, the glycoprotein coating over the intestinal tract. After adhering, the organism multiply in this area and produce toxin called enterotoxin or cholera toxin. This toxin can reproduce the symptom of cholera even in the absence of vibrio organism. Now, if we talk about the cholera toxin, the cholera toxin is AB subunits. The B part is having 5 units. Once upon the B subunit binds to the ganglioside receptor on the surface of enterocyte. The A subunit is to a ganglioside receptor in the cytoplasm membrane of intestinal cells, resulting in the cleavage of A subunit. Now, part of A in enzyme called A1 enter the cell cytosol. When it enter the cell cytosol, it activates an enzyme called adenylate cyclase. This enzyme in turn converts the ATP into cyclic AMP. When it converted to cyclic AMP, which stimulate the active secretion of electrolyte such as sodium chloride, potassium bicarbonate from the cell into the lumens. Now, what will happen? These ion will go. They will water will flow. Water flow the movement of these ion from the cell via osmosis. The watery aplex enter the lumen of the gut, resulting in a massive diarrhea that contain neither neutrophil or red blood cells. You know that this diarrhea name is rice water stool because due to this massive diarrhea. So in this way, the water come to the intestinal lumen and it causes a massive diarrhea. It was the mode of action of cholera toxin. Now, what are the sign and symptom? This condition can produce muscle cramping, lethargy, sunken eyes, heartbeat, irregularities, kidney failure, coma and death. Morbidity and death are due to the dehydration and electrolyte imbalance. However, if the treatment is done, the disease runs a self-limited course in up to 7 days. Now the question arises that where this gene come from? This gene come from the gene for cholera toxin and other viral inspector are carried on a single strand DNA bacteriophage called CTX. Lysogenic conversion of non-toxin producing strain to toxin producing one can occur when the CTX page transduces this gene. The villi that attach the organism to the gut mucosa are the receptor for the page. Non-oven Vibrio cholera is an occasional cause of diarrhea associated with eating shellfish obtained from coastal water of the United States. Now, come about lab diagnosis. In lab diagnosis, the area where the disease is endemic are for the detection of carriers. A variety of selective medias that are not in common use in the United States are used in the laboratory. For diagnosis of sporadic causes in this country, a culture of diarrhea stool containing Vibrio cholera will show colorless colony on Mekong agar. Why? Because lactose is fermented slowly. The organism is oxidase positive, which distinguishes it from the member of the Enterobacteriaceae. Anti-SI agar in acid slant and an acid butt without gas or H2S are seen because the organism ferments sucrose. A presumptive diagnosis of Vibrio cholera can be confirmed by agglutination of the organism by polyvalent O1 or non-O1 antiserum. Retrospective diagnosis can be made serologically by detecting a rise in the antibody titer in acute and convalescent sera. Now treatment, what is the treatment? The treatment consists of prompt adequate replacement of water and electrolytes either orally or intravenously. Glucose is added to the solution to enhance the uptake of water and electrolytes. Antibiotics such as tetracycline are not necessary, but they shorten the duration of symptom and reduce the time of excretion of the organism. Healthy food must be taken. Prevention. What is the prevention? Prevention is achieved mainly by public health measures that ensure a clean water and food supply. The vaccine composed of killed organism has limited usefulness. It is only 50% effective in preventing the disease for 3 to 6 months and does not interrupt transmission. A live vaccine is available in certain countries but not in the United States. Neither the killed nor the live vaccine is recommended for routine use in travelers. The use of tetracycline for prevention is effective in close contact but cannot prevent the spread of major epidemic. Prompt detection of carrier is important in limiting the outbreak.